Okay, so I was really tasked with the idea of providing an overview of ACL rehabilitation in North America, Canada, but I thought what I would do is actually give you a difference between Canada and now where I am in the Middle East and Aspetar, because it's two very, very different setups with very different systems, and I think it may be interesting for people to understand the differences. So the first is a general overview of what we use for Stability 2, and this was designed from an amalgamation between Fowler-Kennedy's protocol in London, Ontario, as well as University of Pittsburgh. And it's really three phases: tissue protection, movement control, and then functional optimization. And whilst I totally agree with Andy that we don't want to be focusing on a time-based rehab, but we do want to think about, athletes, patients, they do want to have an idea of of the time constraints in and around those programs. This is a pragmatic, low-cost, resource-light program, and it can be implemented anywhere. Stability 2 is a 31-center randomized clinical trial based in 3 different continents, so we have to be in a position where we can actually apply this in numerous places. In terms of tissue protection, we want to decrease inflammation, increase range of motion, and so we're focusing on general range of motion, swelling control, quadriceps activation, and return to basic activities of daily living. And it's generally somewhere around 4 to 8 weeks post-surgery. Concomitant procedures will determine the rate of progression. So if we have a concomitant meniscus repair, particularly roots, and then also collaterals, that may slow things down a little bit. Graft type and LET does not change the course of our rehab protocol. And we really want to have control of swelling prior to doing significant weight-bearing exercises. In terms of the movement control phase, we're wanting to promote strength, neuromuscular rehab, cardiovascular retraining, and really preparing the patient to return to impact activities. And this is going to last maybe until around about 16 weeks, so about 4 months post-surgery. We can introduce isokinetics if it's available in your clinic, but really you've got to have full range of motion, no swelling, and adequate muscle control. And I think very importantly, no meniscal or patellofemoral pathology. So we want to make sure that that's a quiet knee before we're doing anything aggressive. And the motor control phase ends when the patient meets all criteria and they're able to then go to jog. So again, very similar to what Andy was saying, is that we want to have good muscle control and a good core control to be able to cope within the higher impact loads. And then you get into the functional optimization phase, where introduction of dynamic activities such as running, jumping, agility training, and of course sport-specific training. And that's going to last anything from 7 to 12 months. And it's going to be very different for pro athletes versus recreational athletes, so people who are actually got a normal job and maybe can't devote so much time to their rehabilitation. So you have to be able to be flexible with that. Now, return to sport testing we do utilize. It's primarily used as a research basis, but we do use it, and we use hop tests, we use isokinetic or isometric quad strength. But probably one of the more important things is just a qualitative movement assessment as the kinesiologist or physiotherapist monitoring the athlete and seeing how they move, and that will often give us cues as to whether or not we should slow them down before they go back to play. Now, we take the other end of the spectrum, we have Aspetar. So what's the mission of Aspetar? Well, it's really helping all athletes to achieve their maximum potential. We have systems and protocols in place. We have a huge facility with amazing equipment and a significantly large team. That's the rehabilitation team at Aspetar. This is very different to what I had access to in Canada. I'm sure very different to many of us in the audience. The facilities are world class. So we have all of these different testing setups and places where not only rehabilitation but functional testing setups that maybe, again, most places will not be able to access. Here we focus on an individualized approach. We're looking at graft type, sport-specific training. We look at training history. We can look at the social support, the psychological support around the athlete, and we look at the various cautions and some of the deconditioning issues. And we recognize that every patient, every athlete coming through there is going to have a very different journey to get to their end goal, and therefore, it has to be a multidisciplinary team. We have multiple rehabilitation components, and very similar to, I'm sure, many other big centers such as isokinetic will have all these different aspects which we want to try and achieve, and individual people are going to be addressing many of those. And so if we look at through this process, we have this integrated rehabilitation components and then testing every 6 weeks. And then if the testing, depending on the testing and how that goes, we can then go on to the next level of rehab. And so we're using data to inform progression. And, obviously, I can tell you we were not able to do that in London, Ontario. So this is very, very different for me. And this is just, this is an ACL week, a common ACL week for Aspetar for an athlete coming through, depending on their phase of recovery. So the core principles: individualized approach, assessment-guided rehabilitation with mandatory 6-week testing. Every single ACL reconstruction that's done at Aspetar goes through this same program, so we're not losing patients, we're not losing athletes to different rehab programs. We have MDT contributions, so we have surgeons, physios, team docs, biomechanists, all giving input in terms of progressing the athlete onto the next level. But of course, the downside is it's more expensive, it's resource heavy, and it is hard to replicate in different parts of the world. Thank you very much for your attention.